Hi, everyone. I just wanted to enjoy some Kentucky Fried Chicken before I started the presentation. I'm gonna dig right in. There's no chicken. I wonder what this could be. What is this? Lung cancer? Thank you, Past Joseph. With that in mind, Group 29 presents The Burden of Breath, Lung Cancer in Kentucky. To first understand the scope of this issue, we have to look at lung cancer statistics in Kentucky. As you can see by this chart by the CDC, lung cancer incidence in Kentucky is much higher than the national average in the United States. Kentucky has, per 100,000 people, 75.8 cases every single year. This is much higher than the United States at 47.1, and even higher than Virginia at 46.7. Keep in mind, Virginia is a nearby state. In Kentucky, it has the highest lung cancer incidence with 4,900 cases annually. It has an average age-adjusted incidence rate of 55% or higher than the national average as well. Lung cancer in Kentucky is 28% of all cancer cases as well. And one additional interesting fact, lung cancer in Kentucky is 1.4 times higher in males than it is in females as well. Let's now look at lung cancer mortality. As you can see by this chart by the National Cancer Institute, Kentucky, yet again, almost doubles the average of the United States. It has a lung cancer adjusted mortality rate of around 54.7. This is much higher than the United States at 35 and Virginia at 35.3. Lung cancer in Kentucky accounts for 3,500 deaths annually, and this is 56% higher than the national average. 36% of all mortality in Kentucky is also attributed to lung cancer. This is really high. Now, this is just the state of Kentucky. Now, when we look at the Appalachians, we can see even worse trends. As you can see by this image right here, this is a map about distressed locations in the Appalachian Mountains. With this in mind, survival rates among lung cancer patients in the Appalachians are much poorer than compared to the state. Compared to non-Appalachian residents in Kentucky, the cancer mortality rate is 15 to 36% higher in Appalachian residents. And in Kentucky, the mortality rate for lung cancer in the Appalachian Mountains relative to the remainder of state is 18.2% higher. This means residents in the Appalachian are 18.2% more likely to die of lung cancer compared to other residents in the state. Now that we've looked at all of these stats, what do we look at some of the risk factors that may be causing this? I'll pass this over to Ria to talk about it.
Hello there, my name is Raya Kwam, and welcome to my section of the presentation where we will be discussing the risk factors that are associated with lung cancer in the state of Kentucky. So let's just jump right into it. The main three I wanted to discuss with you today are late diagnosis, smoking, and radon exposure. So late diagnosis can be applied to any cancer in any state, but specifically this really seems to be an issue for people in Kentucky. It's really seen in people who don't have insurance or who have Medicaid, so people who don't have private insurance. These people are significantly more likely to be diagnosed too late. And as we know, lung cancer is kind of a nasty cancer. If you get diagnosed, stage 4, stage 3, can be very hard to come back from. So this specifically is really bad. Smoking, Kentucky has the highest national smoking average. 1 in 3 people, let me say that again, 1 in 3 people smoke in Kentucky. There are no statewide protections. So, you can smoke at work. Secondhand smoke is obviously an issue. It's very much ingrained in the culture, as we will discuss later. Very big risk factor. And third, we have radon exposure. Exposure to radon gas is the second leading cause of lung cancer in the United States. And yet there's very little discussion about this. So let's change that. And the Appalachian Mountains are known for having plenty of radon. So those living in this area are very much at risk. Going into this a little bit more, there's a very limited access to healthcare in a specific demographic. So higher odds of late-stage lung cancer diagnosis were found among males specifically, those who live in Appalachia, and those who are living alone and aged 50 to 69, and as we discussed earlier, those who are uninsured or have Medicaid benefits. So, we've got these males, they're living alone, they don't have anyone, encouraging them to go to the doctor, they are exposed to radon, they have no insurance, so they don't really have a want to go to the doctor, it's expensive. All of this together it really shows that a certain demographic is more likely to be diagnosed too late, unfortunately. And obviously smoking, we have the leading cause of lung cancer, and then secondhand smoke is super bad, and cultural factors. So Kentucky as a culture, smoking is very much normalized. They have a low tobacco product tax, a lack of statewide smoking ban, and a lack of spending on tobacco prevention programs. So little is being done to help those who do have a smoking problem. And a low minimum legal age to purchase cigarettes exacerbate the high rates of smoking, right? So younger and younger people are smoking, super cheap to get cigarettes. All in all, it's definitely not helping the problem. And then finally, we have radon exposure. So just to go into what radon is a little bit more, this is a radioactive gas that naturally occurs from uranium decay in the ground. So this can infiltrate your homes through cracks in your basement, the flooring. There are approximately, just to put this into perspective, 20,000 radon-induced lung cancer deaths annually. And most of these occur in those who are also exposed to tobacco smoke. So we have, these middle-aged males, they're living alone, they're exposed to smoking their whole life, and now they live in a place filled with radon. All of this just kind of snowballs and really goes to show, why the lung cancer rates are so high, and additionally, why mortality is so high. With that late diagnosis, it's really hard to come back from that. So if we, think about all of these things, maybe we can come up with some sort of solution. And just to put this a little bit more into perspective, the EPA recommends homes be fixed if the radon level is 4 picocuries or more. Look how much of Kentucky is at risk for that. That's crazy. Thank you.
Hi, my name is Hillary Ina, and now that we've discussed some statistics and risk factors for lung cancer, I will now be discussing some of the potential solutions and recommendations that our team has come up with after reading through multiple articles and through our own discussions that we believe can assist our specific population of adults in the state of Kentucky with lung cancer. The 3 recommendations that we've come up with are patient-provider discussions, radon testing, and continued research. So the first recommendation that we have is increasing collaborative patient-provider discussions in a primary healthcare setting. Oftentimes, there's a lack of open communication between patients and primary care providers over care. In fact, in a study done in the United States amongst lung cancer patients, most admitted that they received little to no communication from their primary care physicians about their lung cancer treatment. So, open discussion about health can lead to patients being directed towards the necessary resources that they need for lung cancer treatment, such as screenings, which is an effective form of community outreach and education for these patients as well. This can be tied back to the concept of primary care physicians serving as the gatekeepers of healthcare, allowing access to other types of specialized healthcare as well. This is why we believe that both physicians and patients should work together to have open discussion and trust amongst one another. The second recommendation that we have is increasing radon testing in the home in Kentucky. This is a recommendation that we found heavily necessary after our research through multiple articles about the potential risk of Kentucky residents and radon exposure and its effects on lung cancer, like Raya talked about earlier. Regular testing on radon in the home can be an effective preventative measure of lung cancer, and majority of Americans have never had their homes tested for radon gas exposure. As shown in this picture below from Dwight Instruments, radon gas enters the home through the soil and pollutes the air in the home, resulting in a toxic breathing environment for the residents, which can lead to things like lung cancer. Also, according to the article from Stanifer et al., counties with lower median house values, higher rates of adult smoking, and higher rates of lung cancer will be the ones that should benefit most from campaigns to promote radon testing in the home. This is relevant to our numerous discussions in class on healthcare inequities that plague society in various ways. The final recommendation that we have is increasing research conducted on causes of increased lung cancer within adults in Kentucky. While seemingly simple, this is something that our team really believe should be looked into for a number of reasons. Firstly, most of the research we found on our infographic and presentation only told us that there was an odd discrepancy of there being significantly higher cases of lung cancer in Kentucky, specifically in the Appalachian regions, than in other parts of the United States. But all of this research was missing the why. Is it an issue with cost, access, quality of care, primary care, long-term care, medical technology, or even insurance that causes this discrepancy? We don't know. So it allows us to think on many of the topics that we covered in class, which we really appreciated. And the only consistent research that we saw being conducted on how to help alleviate these issues was through research being done on lung cancer screening techniques being implemented in Appalachian, Kentucky. But a large limitation on this research would be that many papers are written by the same people, such as Cardarelli and the University of Kentucky, which does not give an appropriate range of data to observe. To leave you with some food for thought, according to the Lung Cancer Foundation of America, in 2022, there were 130,180 deaths from lung cancer, which is as many as breast cancer, prostate cancer, and colorectal cancer deaths combined. However, as you can see in this graphic from the LCFA on the right, only $3,580 of federal funding was given towards lung cancer research for 2022 for the entire country. With that being said, now on to Joseph for the discussion questions.
It's Joseph again. Now that Hillary has talked about some of the potential solutions, let's look at the discussion question. Let's talk about question 2. What do you believe are the most effective strategies for increasing the awareness about the risk of tobacco use and promoting early screening for lung cancer? Now that we've looked at our discussion question, here are some of our references. Page 1 and page 2. Thank you everyone for looking at our presentation, and I hope you enjoy. Thank you.